Hey guys, I'm Amanda Lindeberg. I'm the owner of Lulu Med Spa, and I'm here with two nurse practitioners that we have brought onto Lulu. I'm going to let them introduce themselves really quick, and then we'll get into it.
I'm Cassidy Payne. I'm one of the new nurse practitioners here. I'm so excited to be at Lulu.
Hello, everyone. I'm Allison Bennett. I'm one of the other nurse practitioners here at Lulu, and I'm so excited to be here. It's actually just quite amazing, the culture and just the way that they've all been so welcoming, and we're excited to answer all of your questions, and hopefully you'll get to know all of us.
Okay, so the girls have never done a podcast like this. They're a little nervous, and I told them we're just here to hang out, and I want you guys to get to know them a little better. Obviously, a lot of their patients that they've been treating for years are coming to see them. But if anybody that's new and wanting to check out Lulu, and you're wanting to figure out which injector you want to go see, we all vibe with different people, so I think it's great to get to know your injectors and see who you'd like to go to. So we're just going to do a really quick round of fun things: coffee or energy drinks?
Coffee. I have a no about energy drinks.
Agree, coffee, and I typically like a hot coffee in the morning and then ice throughout the day.
I always have to have one coffee in the morning, and then I have another coffee about 3 o'clock. I need an afternoon coffee. I know I saw a TikTok recently, and it was talking about how bad energy drinks are for you. And I already saw the thing about Alani and cancer. And so we're trying to not drink them. Okay. Early riser or late night owl?
Early riser. I am in bed no later than 9 o'clock.
Early riser, but I am in bed no earlier than usually 11 or 11:30, so I need more sleep. So that's
How early are you guys getting up? Like, how early is early?
I'm usually up between 4:30 and 4:45. My kids leave to get on the bus by 6:30 if they're not riding with me. So we make breakfast every morning, and so I've got to be ready before they're ready.
And I'm usually getting up between 5 and 5:30. Days that I train, I get up at 5. Other days, I usually like to have quiet time and do my devotional and that in the morning and do my things, watch TV I can't watch normally, like my trash TV, like if my reality TV that I might want to watch the news, and then start getting the troops up. So
I love that. We guys are early risers. I am a night owl. I mean, I can't be because I got to get up early, but if I could, I'd say I like to go to bed around 11:30. If I could get up every morning at like 8 a.m., that would be perfect. Getting up, I got up for like a year straight and went to Lifetime and worked out every morning at 5:30, and it was like the most tired I've been in my whole life because I cannot go to bed early. I try so hard. It's like I'm not wired that way. So full glam or no makeup?
First of all, I don't even really know how to do my makeup. So if I'm trying, please be patient with me because it's pretty.
And I would be more full glam or soft glam. I love to do makeup. I'm the one that gets up and I put makeup on to clean my house, to work out in the yard. I am a full makeup. I wish, and I think it's because I don't look as good as you others without makeup. So I've always thought that I need makeup.
So same with me. I will always put like color science on, but I don't know how to do makeup very well either. Like I feel like I'm not good at it. Like I don't know how to do eyeliner or eyeshadow. So I just do like the bare minimum, but I love like when I get my makeup done, I feel really pretty.
Impressive eyeshadow tutorials. I'm like, it all just looks brown at the end of the day.
Favorite treatment to receive?
All right. I would say mine is skin pin microneedling. I love getting that. And I just, I feel like it's downtime is very little. I'm very fair skinned. So it's like we're busy. We have busy lives. So there's not the downtime that you don't have to worry about being, but I also love a good glow to facial. So that's, to pamper myself. So that's,
same.
I would have to say it's a cross between neurotoxins or lasers. I feel like lasers are so transformational. Like just one laser gets you in the door, but like you see the results and then you're like, okay, I can see how much this is changing my skin. And neurotoxins just you feel immediately better. It's like a spray tan.
I would say neurotoxins and a facial, because facial obviously is relaxing. It feels so good. Neurotoxins, I mean, I'm not going to lie. I think it hurts a little to get Botox, but the results are 100%. Okay. I want to ask, I got a question. What is your favorite treatment to perform, to do on someone as an injector? What is your favorite thing to do?
but in the last few months, I've kind of focused more towards even the full facial balancing. And I just love that, being able to, and like having the patients that trust you and letting them know, like, we're not going to overfill you. You're going to look like yourself, just refreshed. And the longevity of that is what I think is so important. But I think just doing,
I think it just depends on the patient. Like, you have your older patients who just want to feel restored, rejuvenated. So obviously with them, you're looking at like full facial correction. Or you have people who are like insecure about their skin and like their dark spots or previous like acne scarring. So I mean, like, to me, I think it just varies depending on the patient. Like, I can't say like that's my favorite. I will always do that because I have to choose what's best for that patient at the time.
Yeah, I would say probably my favorite treatment would be full facial balancing, just because of keeping everything looking natural. And then we used to have company all the time and just wanting lips, just wanting this, and now people are open to the idea of just kind of like, maybe you just need a little bit here, a little bit here, little tweaks here and there. So I love that. But I agree, like, just if someone is insecure about something, and for us to be able to take that from them and make them feel better, like, that's like the favorite part of our job. Like, it's like, and that might be an acne scar, or that might be, my lips have always been crooked, and we fix that. So it looks different for every patient.
I would think a lot of it is just being intentional and just like building that relationship with them. And like you said, it depends on if it's somebody that's in their 20s or if it's someone that's in their 60s. It's like learning that client, assessing them, like seeing what their goals are, and then what's going to be the best benefit, getting that treatment plan that's going to be the best for them, like on their budget or whatever, what they have going on in their life and things like that. I mean, I think just it's so important. I feel like I always say, like, Cassidy and I talked before, it's like a lot of our patients, they are our friends. So it's like, it was like an easy transition when you come here, because like a lot of them, they were friends outside of this, which you don't always see that. And I mean, yeah, we may not be hanging out with a lot of the people we see here, but we do become that relationship where they want to, they want to be here and they want to see you more, and they want to, and it's fun, and it's just, yes, exactly. Yes.
And it's fun, and we look forward to our conversations. Yeah, I agree.
This is a hard question. I would probably say my injecting style is, hey, let's do this. Let's let it sit and like marinate, and then let's maybe add some more. Like, I'm never like, hey, let's do 10 syringes. Like, let's let this sit and then let's reevaluate in a couple months. Like, I just don't want to overfill people or ever, and then be like, well, I don't really like this. And so I'd rather just say, hey, let's sit, let's see how this swelling, when the swelling goes down, let's see how this looks, and then we'll reevaluate. But I just think for 10 to 12 syringes for me at a time, it's like, unless their face is just sliding off of their skull, like, I don't really feel like I'm going to make vast improvements that quickly. Let's let it sit and see how you feel.
So it's not necessarily like a conservative injector. You just like to take your time. It's like you can get there, but you don't feel like it needs to be done, especially if someone's never done filler or anything. To sometimes seeing themselves with that much is sometimes so drastic. It's like it doesn't give them time to adjust to it.
That, especially when it's someone new that's been in your chair, like that follow up, whether it be 3 weeks or whether it be a couple months out, and that knowing. I mean, I feel like education, and I love that you like always are like continuing education is so important here too, is because then you're placing smaller amount of filler a lot of times in the proper planes and in the proper placement, and you can get the best result versus having to put 7, 8, 10 syringes of filler in someone.
Sure. What's one thing your patients are surprised to learn about you? Do you have anything fun, quirky that we need to know?
I think one thing surprising is a lot of people, I mean, of course, my friends know, but a lot of people don't realize I had gastric surgery in 2019 and I lost 100 pounds. So yeah, so that's one thing that's interesting. So I feel like it was one of those things when I was transitioning into aesthetics. I mean, it was life changing for me, of course, and then to be able to, the confidence it helped, because I think, oh gosh, would I actually went into aesthetics if I wasn't feeling good about myself? And I love it because it's hard. It's not, yes, surgery, people, oh, that's easy. They think that's easy, and it's not. I mean, you have to maintain that lifestyle. And so that's what I'm super excited about here too, is being able to get back into the wellness like weight management, the hormone optimization, and being able to do a lot of that to be able to like help those people with along their long-term goals. So I think, yeah. So that is kind of an interesting. So that's kind of, yeah, I know that's not really like, I know I was trying to think. I mean, I love a good crime junkie podcast. I mean, yeah, I mean, my husband, I think worries sometimes like, why are you so into all of that? But I do love that.
Going back to her having the surgery, and you said like afraid to go into aesthetics. We've talked about this before on the podcast about how like when people walk in the door, we're not looking at people like that. Like we are just happy they're here. We're so excited to help them. But like I remember a few of us were going to a hair salon and we were like making relationships. And I remember when I walked in, I was immediately like really insecure about my hair. And like I was thinking, oh, they're looking at my hair because that's what they do for a living, And they're like, we're not looking at your hair at all. And so I think that's just something that a stigma with med spas, people walk in and they immediately think we're all like looking at everything on them. And I always told like, they'll be like, oh, don't look at my mustache. I'm like, oh, I wasn't even looking. Now I see it. I wasn't even looking at it, So I agree with you though. It helped give you the confidence, but also knowing that if you're, now that GLPs are an option now and a thing, like if you're coming in and that's something you're insecure about, like, I mean, I would say 90% of the staff is on a GLP. So we're all struggling in different ways. So we're all here to help. And so you're not going to be judged when you walk in the door. Even though we all think that about ourselves for sure, I think. So
I call my husband Big Daddy.
It's like I can't.
And then all of the people that know him now call him Big Daddy. And so sometimes people don't know his name. Like, I don't know. I just one day started calling him Big Daddy, and like that's his name. I don't like know him as Big Daddy. Yeah. He was like, "Hey, are the new girls gonna call me Big Daddy?" I'll work on that, babe. I'll work on that. What else is something different?
That's hilarious.
I want to be that Pinterest mom, like so bad, like Pinterest and do all of that. And I'm so creative sometimes. And then other times I'm like, yeah, here's some glitter. Like I really want to be that mom. And it's just like, I run out of time.
I know. I agree. I want to do all the things. And I'm always like in the holidays, I'm like, we're going to do the gingerbread houses and we're going to do the cookies and we're going to do all this. And I have it all pinned on my Christmas board. And then it's like, kind of makes me sad because then another holiday rolls around and we're so.
I always forget to take pictures when we're at family events. Like I never remember to take family pictures. I'm like, well, there we go again. No family pictures.
We were there. I know. One of my friends is like that. She takes all the photos. I'm like, we would have no documentation of us even being if we didn't have her. What does your ideal day off of work look like? Like if you could have the perfect day.
I would let somebody else wash my hair for me and dry it and style it because I don't know why, but washing your hair and like drying it and doing all the things takes like 17 hours. Right. I mean, like a total shower with all of the goodies takes forever. Other than that, I would probably sit around and do nothing all day. I feel like we go, and to just sit at home and watch medical shows that I've watched a million times. Like I am a Grey's Anatomy junkie. I love The Pit and all of those. Like I like to pick them apart. So I think just sitting at home.
Tell us why you're so busy.
I have 3 children. They're very close in age and my boys are in flag football right now. My oldest is in basketball and flag football, and my daughter plays club volleyball. So every night of the week is taken up by somebody's practice or something else to do besides that. So yeah.
I think mine would be, yes, going to dry bar, letting someone else do my hair. Then I would love to go. I love getting a good massage. I love that. And then, yeah, and same thing, because it's just busy. Life is so busy all the time. I think just sitting outside, sitting by the pool, just having like, just relaxing, even if it's reading a good book. I think that would be the ideal relaxing day. Yes.
Are you a routine person or go with the flow?
I am a routine person, but because of life and kids and a husband and everything, I feel like you have to sometimes go with the flow. I used to not adjust to that very well. In the last few years, I think the older I've gotten, the better I've gotten at that. I do, I've gone back to my paper calendar, not just having everything in my phone, because I want to like time block. And so that makes me feel better when I can sit down on Sunday and time block my week. And, I kind of stopped doing that because if I missed a day, then I was that OCD that I had to go back and like fill it in. And I was like, no, just if you miss a day, just go on. So I'm learning. It's a work in progress. So yes, like I said, I'm almost 50 and I'm the last few years learning a lot of new things. So
I am a total routine person. Like there is a time and a place for everything. My kids even I've created monsters, I'll say, because they're like, okay, what are we doing tomorrow? And I'm like, okay, we have this to do tomorrow. And then if we throw something else in there, there's a million questions. Why? What happened? I feel bad, but I'm like, I wish I could go with the flow, but I'm so type A. I don't know how to be any other.
I'm type A with like my job, but when it comes to life and the kids, I'll ask Liz, I'm like, where are we? What time? I don't even know what field I'm picking my children up on. That sounds bad, but Lewis is Mr. Dad. I mean, he has got it all taken care of. It's all in the Google Calendar, and he'll be like, you need to go to this field, Amanda. You need to pick him up by this time. Like, he knows everything. I'm just like, but I think it's just because I have so much at work and my brain is so overloaded. Like I can't handle anything else, but I have gone back to paper calendar too, because I feel like I couldn't keep up with the Google and then our Boulevard. And then like, so I was just like, I need it all in front of me. I really want to get that like skylight thing, but it's so expensive. But I just think if they could have their chores and they could mark off and have rewards, and I wouldn't have to say the same thing 20 times.
Oh my gosh.
Because it's like on the way to brush their teeth, they've already forgotten the
Squirrel. Mine will stop and be like, hey, I'm like, go brush your teeth. And then they'll be like, oh, there's a ball. So I should probably dribble down the hallway. And then what did I do? Oh, yeah, there's like a car over here. So let's take that. And I'm like, well, just brush your teeth.
I went to a training a few weekends ago with Zach Alley, and he like had a list of different injectors, and it's the talker, the really educated, uses education for everything that they say, and through all these different. He's like, what kind are you? The pushover, and he said we're all like a mix of two, and he was talking about asking people in the class, and I'm definitely like I feel like I know my patients very well. Like you said, we're friends. A lot of times they're telling me about their divorce they're going through. They're telling me about something bad that happened in their life. That's why I feel like too at home, I think it gives me anxiety a little bit because we see so many patients and I hear so many good and bad things that I go home and then it's like, I'm kind of thinking like, man, when's something going to happen to my family? Because if I'm being honest, like, it's like, I have like, the girl that passed away a week ago, a girl was in and that was her best friend. And then I had someone else, a patient I hadn't seen like a year and I didn't know where she was. And she's like, I've had a really bad year. And then talking about her girlfriend's boyfriend, buying a dab pen and it being laced with fentanyl and dying. And it's just like, we hear a lot, and we absorb it. And so, but I love those patients because we're close. And I've said before, I feel like what creates loyalty with patients, obviously doing a good job and making them feel comfortable, but them feeling like you care and being their friend, because they can go to anyone. So I love patients like that are just open and they tell me their life. I like to get to know them. And then I use education too. I'm less of a pushover nowadays. I used to probably be more of a pushover back when I was first starting because I probably just lack the confidence to say no sometimes. We talked about it before with Taylor on the podcast. Like someone comes in, they're like, it's my birthday. And, they can't really afford a lot of things. They really want their lips done because they just want their lips. They've always wanted them. But maybe they have a really recessed chin and it's like, do you give them the lips for their birthday or do you not?
Yeah.
And so there's times like that where I'm like, okay, as long as we're on the same page and you're going to work to be in a budget, or maybe I'm going to have a chance to have a model and I'm going to call you and get you in for a model because I know you can't afford it. Things like that. So those are my kind of patients. I don't know. But then somebody like he said, like Zach, he's like, I don't like the patients that talk. He said they annoy me. Like he was honest. He's like, I like the patients that come in and literally they've done all their research. They know the results I give. They see my before and afters. They come in, they say, I know what it costs. This is what I want.
Right.
And he loves that.
Yeah, I agree with you. Like I said, I just over and over, I've said, I just think relationships, we're in the relationship business. I feel like, they're spending a lot of money to like do things. They trust us. We need to like earn their trust. But I also feel like, yes, like just being able to talk and communicate. And yeah, if someone's having a bad day, they may not be, wanting to talk or they might not, you might have the ones. And then like education. You have some there the other day, just the other day I had someone, they said, oh, I love that you're always, because I said, oh, I'm going to training this afternoon, that you're always continuing your education, that you're always like staying up on what, is there not necessarily like not doing something just because it's like it's a trend, but like educating ourselves and being knowledgeable about what we're doing and just to be better, and just always trying to make yourself better. And I said, that's one thing I, value with you and Lulu is, the support I feel like that we've gotten already, and that everybody really genuinely, like if one of my patients came in, I would not care if they see you or Cassidy or Taylor or Dianara, none of that. Like we all, like, we know that they're going to be taken care of and they're going to be, and like be seen. And then, yeah, they're going to go back to, whoever, but if it doesn't work out with their schedule or something, or like, I'm not going to maybe be doing a lot of lasers and I want to do more hormone replacement. They might see Cass for lasers and see me for the other. So, I think but I just, the patients that, yes, I love. I said I'm a talker. I guess probably maybe to a fault a little bit. I don't like to talk in front of like people like this, but but no, I feel like I can talk and relate to anything. I feel like we're all therapists too. So it's just kind of fun. But that it is good that they do trust you enough to like tell you all of their things, but it sometimes can get heavy, and then, but it, I don't know. I guess it's part of it.
To kind of bounce off that, I love talking. Now I can shut up. I can tell you that, but I like deep, meaningful conversations. Like I'm not a superficial talker. I'm not like, hey, how's your weekend? La 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 la. I like, oh my gosh, like tell me something intense. Like I, I want those deep, meaningful conversations. I want to build a rapport with my patients that like I know if they're going through something, or hey, I need to be quiet today. Like they're going through something big, like they came in with red eyes. Like I know that they just need to sit in my chair and we just need to be silent, and
be a listener. Yeah.
And then I am probably an educational injector. Like I want to tell you why I think you need this, because something shifted in your face. And like, we all age a little bit differently, and women, especially versus men, just age so much differently. And I just want to explain why I think this is important on your face and why this treatment is going to give you the best results or the best outcomes. So I guess I'm educator. Yeah.
Going off that, tell us what you did before aesthetics and what you're doing and kind of how you got into it. And then also maybe if you're just giving someone some advice out there on how to get into aesthetics.
So I've been in the medical field for 17 years. I still work at the heart hospital part-time. So I started my aesthetic walk just getting neurotoxins, and I loved it. But it was like, okay, like then I started watching all these Instagram posts during COVID, and they were like, oh, you can do more. And I was like, okay, this is interesting. I really like this. And then I started seeing somebody, and we started doing more and more to my face. And I was like, it just made me feel so confident. And I wanted to be able to provide that to somebody else. And so I was like, okay, I think there's a niche for this in my N, and obviously got an N. And since to this day, I love it because I love making people feel good in their skin again, where they feel like they may be lacking or need a little boost. Like I feel like I can give that to them, and I'm like, oh, and they leave here confident and like, thank you. It's one of those things where as a medical provider, like you see the worst of the worst, and like this is like the happy medium where you get to make people feel good. Yeah.
What advice would you give someone trying to get into aesthetics?
I wouldn't say one class is just going to get you into aesthetics. Like just because you took a 1-day Botox course does not mean you're proficient.
Like your course and then like go rent a room and then
No, I mean, you could do that, but I don't think you're going to get the best outcomes. I think it takes passion and drive and wanting to constantly feed your mind with more and more education. Like anatomy is key with aesthetics, and you need to learn from somebody who's willing to teach you the ins and outs. more so than anything. And it's not just one size fits all. It's not like, hey, I can give you this blood pressure medication and it's going to lower it. Like with aesthetics, it's totally different. Everybody is so different.
Yes. So okay. So going back, how I got into aesthetics. So I did family practice in a small town in the Panhandle in Beaver. And I did that for 16 years. Then my family, we moved to Yukon in 2018. So I was kind of, for a couple of years, I was not really doing that. I was trying to, do I go work for a family practice? What do I do? Then COVID hit. And I'd always loved, as far as full glam, I always loved makeup, always loved skincare, always loved that. And I had, same thing, I had kind of got started when I was around 43, started getting neurotoxins myself and getting some lasers and some things done. When I was in Beaver, I didn't feel like, I always loved that, but I didn't feel like I needed to do family practice there. That's what I needed to be doing. And I didn't feel like I could really branch out and do that there. So when I came here, then I thought, well, I'm going to go take a training, went to National Laser Institute, did a 2-week kind of training there, then followed up. And like Cassidy said, I mean, I went out to Boston and did some training there. I just feel like, AM spa, those things are just always learning. Shadowed an injector. I mean, just always wanting to do that. Then opportunity came up and there was like 3 places I was picking from. I ended up choosing a place that was close to my kids' school. And it was great. I mean, it got me in the door. I had, some amazing patients. I said, I feel like too, with the industry, if someone's wanting to get into that, I just think too, do the education and make sure, like, don't, count yourself short. Like, don't know your value and don't rush to like go feel like you have to get in somewhere working that just because for whatever reason it doesn't fit. I mean, like, I've kind of had to tell myself that. And I said, and then you do learn along the way, though. You learn of places where you do want to work and don't want to work and like good environments and things like that. But I just feel when I did that and then I've been doing aesthetics. I worked there and then ended up going out doing my own thing for 5 years. Then had to close that down because of issues with our house and everything. So I was looking for a place, and then I'm so grateful to be here now and be able to continue, because a lot of people are like, oh, do you not want to go back into family practice? Do you not want to? But I love, the artistry, beauty, and then just the confidence that you can give people and that just making them feel good. And I love aesthetics now.
Well, and it's nice that aesthetics now is so much like wellness and rejuvenation. So you're getting a little bit of, like, you guys are still getting to keep, like, you're obviously still at the hospital, but if you ever were to be full-time aesthetics, you'd still get some of that medical background with the wellness side of it for sure. And I agree. Breaking into aesthetics seems so hard nowadays. I feel like I get DMs daily on like, can I shadow? How do I get in? Like, this is what I really want to do. I have so many people in my chair. They're like, I'm going to nursing school because I'm going to be an injector. And I mean, I'm fully admitting it was a lot easier when I got in. I got in like early and there wasn't a lot of people doing it. So it was kind of easier to build. I will say that. So I always tell my girls, there's an injector on every corner. There's a med spa on every corner. What makes you different than the person down the street? And you always got to think that you find your niche. And actually, I keep referring to the Zach Alley training. It was a great training, but he was just basically like, people don't even know that I do Botox or biostimulators. He's like, everyone thinks I just do full face filler because those are my before and afters. And so he was saying, find what you're good at, post that constantly. Post it constantly. If you're good at lips, even though you want to do more than lips, if you're good at lips, post your lips. The lips will bring the people in. Then when they're in your chair, you educate them on why they need more than just lips. So it's a way to just just knowing what you're good at, but building off that.
I think like that once you have them in your chair and they trust you, then you can suggest other things which help ultimately them and your practice. Like you may get a weight loss consult and they're here for that. And then they're like, oh, but I've started to notice this or my skin texture. And so it segues into other treatments that you can present them with. And then that's how you keep them.
Yeah. We had a girl and I think I had a girl the other day and we were doing something on her and she'd been to a bunch of places and she asked me about lower face talks and I was about to bring it up because sometimes when I have a new patient, it's that weird, awkward, like you don't want them to feel like you're being salesy or pushy, but you know how good lower face talks is. And so you're more just wanting them to know like, hey, you don't like your jowls, like we can help this. But she actually brought it up. So that was great. But I was kind of shocked that she had never been approached about lower face talks because she's been to several really good places. And so I was like, okay. And I remember one injector telling me that as well. She was like, she'd been treating this girl for years, doing her talks. She'd always like be on a budget with the talks. So she never presented anything else, right? And then one day she comes in and she's kind of can tell she's got a little bit done in her cheeks or something. And she says, oh, well, I went down the street. I was getting a facial and they told me I'd look really good if I got a little cheek filler. And she was like, well, dang, like I never mentioned it because, so it's like, it's that fine line. I agree. It's like that fine line of bringing something up without feeling salesy or just trying to educate them. And we honestly, once they get to know us, they know we want just the best for them and we're never selling anything. I'm never going to, that's what I've heard numerous times in my chair. Like, you just tell me if I don't need it, and I think we're all like that. And then also about breaking into aesthetics, I agree. Like, I think you feel the feeling that you have to work wherever you get the chance because there's no opportunity, because there's so many people wanting to do this. And I'm not saying we all have work at places we don't like. I mean, shoot, I worked at Hertz when I got out of college because I wanted to get into surgical sales and they told me to sell copiers or do rental cars. So I went to and I remember washing cars, and we only like people probably don't believe this because they probably think I'm like, but I'm actually very tomboyish, even though I like to look. But I remember our bathroom, we hooked up to the bathroom sink, and the water pressure was such crap. And I'm like washing these cars, and I'm like trying to scrub these bug guts off. And I'm getting like blisters and I'm like, oh my God, this is not for me. I was like, I need a better job, but I was trying because I wanted to do what I wanted,
Yeah.
So anyways, but it all worked out. But we've all been there. We've all taken jobs we didn't really like, but anyways, but definitely make sure it's a place that you just feel valued and that's good. So,
and find that mentor or find those people that you can with that community, because like the people that are going to be in your corner and that's going to be stand behind you. And because I think that collaboration, we were talking about that the other day at the training, and the trainer was from Texas. And so he's like, oh, I feel like the industries maybe, I feel like most of us get along there. And they're like, oh yeah, around here, it's mostly community and everybody is for collaborating with each other. And I said, that's the feeling you want to get. And so if you're not finding that person, find that mentor, find someone you can trust that's going to lead you in the right direction too.
Yeah. Cause when you're new, you don't know what you're doing and sometimes you need help. And so if you have someone you can message and say, hey, I'm really nervous about this bruise. How do you guys approach? I feel like I'm getting this daily too. And we kind of talked about this earlier, patients bring in a picture and we can clearly see that person has probably had a CO2, they've had a facelift, talking about how to get people to understand like when it's time to have surgical. Like, I feel like that's kind of I will just tell them like, I'm going to be totally honest with you. I don't want to waste your money. Like, this is at the point that you need surgery, but that's also kind of an awkward conversation because some people are like, well, I don't want to have surgery. Yeah. So then you're like, okay. So then you give them the options, but do you feel like you guys face that? And like, what would you go to then if that person did or didn't want to have surgery?
Well, I mean, most of the time when they're coming in and they're like, I want this. And you're like, I would love to help you. But if you're doing this and picking up half of your skin, I'm probably not going to be able to help you. And my thought process is I'm under promising, over delivering, because I can tell you that, hey, I can get 5 syringes in you, but I don't even know if it's going to make a difference. I'm like, but a lot of people are like, hey, I don't have the budget for a $30,000 or $60,000 facelift. Like, can you see what you can do? And then of course I'm willing to help, but I'm like, I also can tell you like, I may not even make a dent in what I'm doing. And I think just being brutally honest with patients is the best policy.
Right. And and also as along that line is, and then just their expectations, like being honest with expectations and let them know like, okay, if you're not ready for surgery, these are the things. I love our consults that we can get the treatment plan lined out for the year and be like, these are the things, this is what it's going to cost. Is this going to be worth your, like in your budget? Like if we do this and we might get you at a result that is okay. But then you might still have to have the surgery down the road. But I mean, a lot of people will look at that and be like, hey, if I can even get a couple of years before I have to do the surgery. So I think it's just being honest with them, being transparent, and then just giving them realistic expectations. So that way they're happy and, and just being honest, because otherwise if you tell them, oh yeah, I can put 5, you're going to look like this. And then they're disappointed because, we just have to have their expectations be.
Okay. So I'm going to ask you a question and then you guys say, if you'd leave it or treat it and how you would treat it, because you're both going to treat them differently. So it's fun to kind of see. Okay. So I have really saggy skin on my neck. I don't want to go get a neck lift. What do you like for the neck?
Okay. I would treat it with some hyperdilute radius, as well as platysmal band tox and maybe like a laser, just depending on like the laxity and the texture of the skin. Obviously, we know that the neck skin doesn't have as many sebaceous glands and is a lot thinner. And so it's a lot harder to treat. And so those are my kind of go-to if they're not wanting anything surgical.
Yeah, and I agree with all of that. And then we were talking to you about hyperdilute radius. They're adding things in now to that. So like you can add in Redensity, which is a hyaluronic acid filler in combination with that, and even get even a better result because you're going to get that nice like glow. It's going to fill in the texture even more and fill in those lines and kind of help give you some skin laxity.
And so as you said, adding the Redensity. So the Redensity kind of gives that patient the immediate gratification when they leave. It fills it in. And then what I love about when you combine an HA with like a biostimulator is that then the HA gives them that immediate when they walk out, and then that gives that biostimulator time to do its job. And then so when things start to fade a little, the biostimulator is kicking in. So it's great. Okay. Next place. Okay. We have a patient. Our chair has a fuller submental areas, a lot of tissue. They're wanting a really good jawline. How would you treat this, or how would you treat it or not treat it?
First, if they wanted a sharper jawline, I would always recommend a chin. Most of the people with a fuller submentum are missing that chin apex or more pronounced chin. So I would definitely treat chin first. And then from there, I'd probably be conservative about whether I choose jawline or lateral cheeks. Just kind of depends from there.
Right. And assessing is because of that is their masseter enlarged, and that using some tox for that area as well.
So another thing, I think when you have a patient like that, a lot of times they have a really large parotid gland. They'll have really big muscles back here. We see it a lot on our dental hygienists because they're constantly turned like this. And so if you can really use tox to debulk that, obviously our first line that we would all choose is recommend to the patient to get liposuction because it's a cheaper option, and they're going to get much better results. Then they can come see us after, and we can kind of fine tune it up. And then if you're going to an injector that offers PCDC or Kybella, you can get that. That eats fat cells. We currently do not do that. I just don't like that it eats anything it gets in contact with. But just know that if you have a fuller jawline and you're seeing an Instagram picture and that person had a full jawline and then has a very contoured, sleek jawline, they have probably had some sort of surgery to get that, because it's not realistic. I don't know if anybody ever saw the one where the guy like was talking, and then when he talked, his filler like stayed like, because they built a jawline, and he was like would talk and the filler would stay in a different position. So that's what happens when you really, yeah. So anyways, adding filler in a full area will bulk it up. So like we said before, there's so many med spas, so many injectors. I'm a consumer new to these things. How do I know where to go? Like, what do I look for?
Well, I think one, we live in the world of social media. So you're going to be following those things. We don't want to follow trends. I mean, go and don't just look at like their just the last few weeks, like go and look at before and afters, look at the things, look at what patients are commenting and, you know, on their comments, seeing what you're doing, seeing if you're seeing different things, like different, you know, they're not just doing all one thing, they're doing multiple things, and like whatever you're trying to do. I feel like too, when you go in that space, you know, even if it's professional, like from the minute you walk in, like, are they having you sign like consents? Are they having you sign, you know, is there policy and procedures? Because those, if you're not signing a consent, and because they want to be, you want to like go to a place that's reputable for one thing. You want to go to a place that has like high standards and safety protocols. And I feel like that too, and just educating yourself. And then as they're talking to you, educating, like if you're doing filler, for instance, like if you're going to get filler and we're having you and we're walking through that consent with you, like that in case there was to ever be an accidental occlusion of a vessel. I mean, it's not happened, but it could always happen. That way we have a way to correct that, and that walking you through that, like on that process. So like, I feel like just that's one of those things, the education on people, making sure they're doing consents. And I mean, I think the professionalism, I mean, I know that's kind of a hard, I mean, it's kind of a hard question because until you get in there, and I guess, yeah, I mean, because I guess there's some people that can, I guess, fake it till they make it too. And so you hope you don't find one of those people. So I don't know if, yeah.
I think for me, like, yes, social media is big. I think everybody's researching and figuring things out for themselves. But I like, what I feel is important is like not one modality is going to fix every single person. So you can walk through it with them. Like your patient comes in and they're like, oh, this, and this. And you're like, okay, we have this available to do. We can start with skincare. Then we can do lasers. Then, hey, if we've got laxity, we can do biocollagen stimulators versus, HA fillers. Do you want immediate results? Do you care about gradually building over time? I also think talking about anatomy, like I said, like anatomy is key. Like the aging face, we need to talk about that. Like, hey, yes, you want lips, but your tissue may not hold 17 syringes of filler in your lips. Like, we just need to be educated and be educating our patients on like the anatomy, what's important, and like realistic outcomes.
If I was picking a PMU artist to get my brows and lips done, like, what am I? Because we're in this business, so we would look for, we're way more critical and look for certain things. But if I was new to these things, I'm looking at before and afters for sure. Like, I'm just like, oh, wow, they deliver very natural results. Or if I'm looking for a certain type of lip, I'm going to go searching for that type of lip, right? If I'm looking for someone that kind of just does undetectable filler, I'm like, wow, they just look like themselves, but just so much better. Like, it's a picture from 2 years later and they look the same, but they just look good. It's honestly, like you said, it's whatever position and whatever phase of life you're in and you're getting into it, whether if you're 25 and you're like, I want to try Botox, or maybe you're 50 and never done anything, your goals look totally different from that person. So that's what you're looking for. So I think social media and look at Google reviews. Not that those are always accurate, but yeah, look, research. I feel like all you guys are coming in research these days. Everyone is so much more knowledgeable when they come in. So, and education. Yeah. See who's doing continuing training, because there's people still injecting Botox like we did 10 years ago. And I'm like, oh God, I have $500 and I got it for my birthday and I'm coming in to the med spa. And what would you tell me to do?
Skincare. 100% skincare. Skincare can make a drastic difference. And it's one of those things that I guess that's the most bang for your buck. Like there are obviously different things I would treat on top of that, but skincare is going to be the best option for me.
Yeah, absolutely. I mean, skincare. I always tell people with aging, I said, if they didn't have a budget and they were coming in getting other things, you want to protect that investment. I mean, but I always say SPF, number one. Learning, like it's in my makeup or it's in my, I hear that a lot. SPF 50 plus, and then reapplying. I mean, that's something I think a lot of us don't think about. If we're like, we work in our car and we're driving, like we put it on at 6 a.m. and then we're driving at noon and we don't think about it. So that's something. SPF, I always say an antioxidant, like a vitamin C, something that's going to protect your skin from the free radicals. And then your retinol or retin-A. Those are 3, like, I think most important things, non-negotiables with skincare. So I think that's,
One treatment of tox is going to be lovely, but that's not something that's going to keep on giving, and skincare will keep on giving. Okay. I've got $1,000. It's my birthday again. What are you doing for me?
We're doing 3 sessions of microneedling. Yes. Collagen stimulation helps with texture, even acne scarring, pore size, like microneedling, 3 sessions. Just do it.
I mean, I told you that's one of my favorite treatments because I think you just get the most benefit from that. Like I said, little downtime. You're going to have the collagen stimulation. It's going to help with pores, fine lines. It's going to help. Like I said, a lot of times too, when someone might have melasma, for instance, and then, and they can't afford or they don't have the time to pre-treat with the hydroquinone to do one of the lasers. I mean, that's something you're going to get some of that pigment being broken down and, eliminate some of that for a very cost-effective treatment.
Okay, let's do one more. I've got $5,000. Are we breaking it into a few appointments? Like, what are we doing? Are we doing like a full face of filler? What are you doing? $5,000. That's my yearly budget.
We are breaking it into multiple appointments. Okay. Let's do it. Let's address your concerns, your biggest complaint, and then let's build skin health. Let's do some lasers to get you glowing. Like, we don't have to use it all at once. Let's just spread it out. Let's spread the love.
Yes, agree. Yeah, get in here, get on the skin health, get that going. So that way you're prepping the skin for when you do the lasers down the road. Look and see if like something like it's addressing. I always say start, look at the face like a house. We're going to start on the outside and look. So like cheeks, chin, jawline. Then you think of the nasolabial folds, the temples, those are going to be like your walls going up. And then like everybody wants lips and they are beautiful, but they're like an accessory. So we need to build the structure around and then do that. So we're going to build the filler. We're going to do that. We're going to get you in for some Glow 2 facials. We're going to get you a package at the anniversary event. You're going to buy that. So you're going to get you a package of those and you're going to do that as well. You're going to do some of a lot of times too, are we needing hyperdilute radius, preauricular, neck? What we're doing that, we're getting that collagen stimulation going as we're doing the filler as well. And and you're going to just be looking amazing with your $5,000.
Yes. What is your goal for this year? What would you like to see in yourself?
Goal wise, I just want to push myself to be a better provider in general, like more education for me. I think there's some places I'd like to expand my knowledge, like in functional medicine, as well as do some more trainings that I haven't been able to do, and just push myself as an injector to just be better. I want to be better for myself and my patients. Like, I will tell you that I am never going to recommend a procedure or anything that I haven't personally done on myself that I don't think's been beneficial to me. Like, I will never sell you on something that I think is the wonderful thing if it didn't do well on me, especially like, I feel like smooth threads. Tried them. Don't really feel like it was worth it for me, but it may be worth it for somebody else out there. But I'm going to be honest with you about treatments that I think have worked and have not worked.
Yeah. And I think, and that's exciting about, coming here and getting into the functional medicine space and more. And I'm currently doing a peptide certification course that I'm very excited to be able to, just, I guess, expand my knowledge of that, get back into some of the weight management. I'd love to get more confident in my injectable full facial balancing skills, learn some new things from you as far as, the PDGF and just different things and things that I had not been using previously. And then also learning, the new lasers. I mean, like the new and doing that. But I think, I'm always prided myself on continuing education. And I think anytime you can go, to any training, like we've, even done, like you go to 2 or 3 revamps trainings, you're going to learn something new every time. And I think in bringing back the knowledge of that. And I think that something that's so key and so good here is, like I said, the culture is amazing, but that everyone, like I might have a specialty or something that I'm better at that I can help expand you guys and vice versa. And I said, I feel like that just like collaborating and learning from each other, I think is so important. And I see that that's here. And so I feel like it's going to be pretty easy to hit that personal goals this year just because of the growth.
I think I said on a podcast, I don't even know, maybe it was Christmas time. I said my goal was to be looking at a face and being able to be like, okay, this patient gave me a budget. How can I give them the best bang for their buck? Like, sometimes I feel like I always use the example of like Anusha, like she'll use like 2 syringes and it's like magic. Like she makes it look so beautiful. And I'm like, I want to be better at that. Like, how can I use less, fit that in the budget and give them those results? After taking the Zach class, I do feel like it's a little bit easier because he puts everything into face shapes. And then you figure out the face shape, then you figure out the class of the teeth, then you figure out positive, negative vectors. And he literally just has a formula. It's not always going to be exactly that formula, but it helps you to kind of just, this is the biggest bang for a square face. This is the biggest bang for a round face, and so on. And so I feel like I'm getting closer to that. I want to get better at that because it's sometimes so hard. You look at a face, especially like a really pretty person. I got to be honest. And we say it all the time, like beautiful lips come in. It's so hard because it's hard to make beautiful lips more beautiful. And, or a face that's already beautiful. And they're like, well, I'm so asymmetric. But then it's like, I never noticed her asymmetry. I never noticed her nose was crooked till she pointed out because for some reason that fits perfect and it makes her really beautiful. So sometimes it's like, I don't know how to make you any prettier, So yeah. So anyway, so thank you for tuning in. Again, I'm Amanda and this is Cassidy and Allison. And we're so glad you stayed and keep following along. We'll have podcasts. I don't know. When's the next one coming out? This month. Okay. Bye guys.